My name is Dr. Jim Powell, chiropractor here in Canton, Ohio.
And I'm Dr. Chip Null, also a chiropractor here in Canton.
We'd like to welcome you to Before the Scalpel. We have a unique program here at Powell Chiropractic Clinic, the only clinic in the United States with this exact program, and we have a 90% success rate.
And we call it spinal decompression therapy, also known as the Discovery Program here at Powell. Welcome.
Welcome. Episode 6, test, don't guess.
Well, I would never want my healthcare guessed with. I would
No.
want to make sure to be very specific and very exact.
Right.
So when we get things started here, we bring in, before we accept you as a patient, we do a thorough exam. And that includes neurological, so we test nerves. We test how those nerves control the strength and the sensation, strength of the muscles, of course.
Right.
And then the sensation to your arms and hands, depending on where the problem is.
Right.
And after we do that exam, then we always take x-rays, because obviously we know there's a problem. We have to be very specific to know where it's coming from,
Right.
and how bad it is. So the more specific you can be, the better.
Right.
Yeah.
We had talked a little bit in a previous episode about an MRI.
Yes.
So putting both arms in an MRI, anatomy, blah, blah, blah. So we take the information from the MRI and then we correlate it to the exam findings.
We do.
The body is so unique that, like, let's say for my hand, each finger sensation is a different nerve. So if there's an alteration in the person's sensation in the first finger and thumb, that's C6, middle finger C7, and so on. The machine that we have, the decompression machine, is so specific. You push the button on the machine, C7, it only treats the C7 nerve.
That's right.
You could have an MRI with 3 or more disc issues, but you find the one that's specific. So we pull back the curtain, if you will, to try to get as specific as possible.
And how do we do that? Well, each nerve controls a specific muscle.
Right.
So we test each muscle individually to find out which one's weak or which one has lost sensation, or both.
Right.
And then we know exactly which one needs to be targeted. Then we
Right.
couple that with our x-ray findings. So on the x-rays, you're looking at the position of the bones.
Right.
We're looking at the specific curvatures, and we measure balance from one side to the other. And we correlate with that with the MRI that shows us the disc. And it's important to be specific. MRI looks at the soft tissues. When we talk about soft tissues, it's the softer component of the body, the disc, the
Right.
muscle, the ligament, the softer portion, where the x-ray shows the structure, the bones, and how they're positioned. So both of them are crucial, because you can have an x-ray that shows a disc space that is less, and then another one that's less, and how do you know which one is the one we need to treat? Other
Correct.
than the specific muscle testing, the MRI can confirm that for us.
Correct.
So it's very specific.
That complete workup that he just described, I can't say that every chiropractic or medical office does as thorough of an evaluation. And here at our office, and you can concur,
Yeah.
we won't accept a patient without an x-ray,
No.
without a full exam.
Yeah.
We've had patients call, hey, I just want an adjustment. And we say, well, this is not the clinic for you,
Correct.
because we go to the cause or the root of the problem.
Well, and earlier we alluded to the number of different techniques we have to adjust.
Right.
Many times we use our hands to move a bone, other times we use instruments. Well, I don't have x-ray vision, literally.
No.
So if there's an issue in your spine
Right.
that wouldn't be able to handle a manual adjustment, I wouldn't be able to know that unless we took the picture.
Correct.
And we found that out many times.
Yes.
So, and that's really where people get injured.
Yep.
And so we're not going to take that chance.
No.
Not going to take that chance.
Not just for the patient, but for our own character and how we operate. We don't cut corners,
No.
ever.
No.
And the unfortunate situation is some folks do, both medical and chiropractic, the same, and that always goes bad.
That's right. Well, and sometimes I don't know what, I think Parker mentioned something about sometimes it's better to lose the patient
Yes.
than to give them the improper care,
Yeah.
And
He
so-
says it this way, I would rather lose you as a patient than fail to get the results that we know we can get.
That's it.
So you have to follow the program to get the results. If you want strong arms, you can't do one push-up one day.
That's right.
You have to do a series of exercises for those arms over many days to see those changes.
Well, and to look at it from the layman's terms, would you build a house without blueprints?
No.
I mean, you could, but that would be foolish. So like you say, we're not going to take a chance. We're going to do it. We're going to do the proper method.
Correct.
And that's what we pride ourselves on.
Yep.
And that's why our system works.
So it's from the findings to the plan.
Yeah.
And we're so specific in our categories. In our plan, from your findings, you're given mild, moderate, or severe in your, literally in your prescription of care, right? Our form.
That's right. Yep. And mild, moderate, and severe is determined by, obviously, the severity of the condition,
Right.
but other factors. There could be extensive arthritis.
Right.
There could be some nutritional issues. There could be some pathological issues going on, meaning other disease processes that require more care and much more gentle care, I guess you could say.
Right.
And all that plays into it.
Yeah.
So.
And what we can honestly say, that we leave no stone unturned. And to be fair, we don't always have every answer, and we don't always have every conclusion. So the cases that we have limited experience with, we reach out to other advisors.
Absolutely. And that's, you can't know it all.
Correct.
You can't know it all. And that's where we've built, I think, a pretty good network.
Yep.
Not just among other chiropractors, but with the medical profession too, in the orthopedics.
Right.
And so many times we co-treat, and
Yep.
we had talked about that before. Physical therapists, massage therapists, orthopedics,
Right.
acupuncturists.
Right.
And many times, Dr. Powell Sr., who is now retired, I've brought him in on patients that either were his when he started and they've continued to come.
Yeah.
We see a lot of that,
Sure.
which is a really neat thing, by the way. And he may, getting a different set of eyes on it, there may be something that I wasn't seeing because you're in the mix.
Right.
You can't see the forest for the trees type of theory.
Sure.
And he'd just be like, I think what you've done is great, but I see this maybe as a possibility and I never even saw it. And it turned out to be the thing the patient needed.
Such a privilege. My father, Dr. James P. Powell,
Yes.
was called the doctor's doctor.
Yep.
Both
Yep.
chiropractors and medical doctors alike
Yeah.
would come to Dad and ask, what do I do? Because I'm not getting the results that I would get. And to be fair, I may have taken that for granted a little bit, because it's easy to like, hey, Pop, what do you think of this?
Yeah.
And give us an answer that took him 40 years to figure out.
Yeah,
And
exactly.
it's just a conversation in passing, and you're like, oh, that sounds good, and you just keep on moving on.
And I was very guilty of that too. I mean, maybe you could elaborate a little bit. I always found it fascinating with Doctor's Hospital and how he got involved with that
Yep.
back in time.
So Doctor's Hospital, which is a hospital in our community that is no longer in existence.
Right.
But at the time, it was structured by doctors of osteopathic medicine.
There you go.
Well, my tongue was tied up there. So,
Spell that.
So there's MDs and DOs. So this hospital was only doctors that were DOs.
Yeah.
And the DOs at the time had some spinal manipulative therapy education.
Correct.
So they understood a little bit more about what chiropractors do.
It was a natural thing.
So they brought chiropractors into Doctor's Hospital and treated them as normal docs.
Yeah.
So they ordered the MRIs and they ordered the blood work. And back in the early 80s, that was a little more complicated in the medical community for the local chiropractors than it is now.
Yes, that's
But
right.
they had open access. And they did grand rounds with the MDs. And the MDs came in and watched the care of the chiropractors.
Yeah.
It was a very unique thing that
Yeah.
I wish more hospitals did.
Yeah.
But sometimes, like it's been said, sometimes if there's too many cooks in the kitchen, you spoil the soup.
That's right.
So we've learned to try to stay in our swim lane.
That's right.
What is it that we know? What is it that we do? And then when we see somebody that's not inside our swim lane,
Yeah.
what do we do with that? You refer to the most appropriate guy that's his swim lane.
And I think to tail off that, he was able to establish a respect
Yes.
for chiropractors among the medical community and orthopedic community that otherwise wouldn't have happened.
Correct.
And still continues to this day. As we alluded to earlier,
Right.
we have some great connections with local orthopedics. And
Oh, yeah.
even to the point where we had talked about in the other episode how we had a doc come over and check out our decompression machine.
Yep.
And so we're all in this together. The important thing is, what's the best thing to do for the patient?
Always.
When we graduated school, we took what's called a Hippocratic Oath,
Yep.
do no harm.
Correct.
So you do what's right for the patient, not always, what may be right for you and what might be convenient for you. We do what's right for them,
Yep.
and we
And
make that happen.
55 years of this practice being in existence, the medical community knows who we are, what we do.
That's right.
And we've always been very consistent. And that established respect goes both ways.
Yeah.
We know who they are and what they do, so we know when to send who where.
Well, and I know you've heard this, and I've heard this. Patients come to us and say, we'll ask, who referred you or how'd you hear about us? Well, a respected doctor in the community said, if you're going to go to a chiropractor, Powell's the place to go.
Yeah, we hear that all the time.
Very proud of that.
Yep.
Very proud of that.
Yeah, it's a blessing.
Yeah. And you had mentioned earlier, too, and I'd like to go off this, that many patients come to us as a last resort.
Right.
And some people see that as frustrating, but I love that.
Yeah.
I love it because I'm like, all right, they've tried everything. All right, now I can literally get my hands on them. I know we're going to help them.
Yeah.
I know we're going to help them.
The ones that don't get success anywhere else
Yeah. Those are the best ones.
always get success here.
Yep.
It's so cool.
It is.
Yeah.
So it's a nice little rush.
Yeah.
Yeah.
So that's the rewarding component of chiropractic.
Yeah.
So we're going to cut to a testimonial, and that testimonial is going to talk about what they've established, how they've responded, what they've done here.
Yes.
And so it's so exciting to hear it directly from the patient.
Yep.
So watch this.
I started having problems where my feet wouldn't work, and I couldn't stand up or walk at all. Was talking to Dr. Null, and he tried a lot of different things. Insurance wouldn't let me have an MRI to see what was wrong. So finally, Dr. Null said, let's go talk to Dr. Powell Sr., see if he has any ideas on what might be wrong. So I'm in his office, and he's doing things. He has me doing this, doing that, moving here and moving there, touch this, touch that. And he looked me right in the eye and said, God forbid it could be something like a tumor in your spine. So I called the Cleveland Clinic, made an appointment in 2 days, had it. They said the first thing we'll need is an MRI. And I just started laughing and explained every time I was turned down. She said, sir, we're the Cleveland Clinic, there'll be no problem. They called me the next day after I had the MRI and said, I just hand carried all your information over to the head of our neurosurgery department, and he wants to know if you could come to the emergency room right now. There was a tumor inside of my spine, pushed it against my spinal cord, and he said at that point I was probably a day and a half away from permanent paralysis. They're so knowledgeable on stuff and the things that they can do for you, and the techniques that they have, and the technology that they have. It's just unbelievable. And yes, I would highly recommend anybody to come here.
Welcome back. Isn't Cliff's story, amazing,
Wow.
almost unbelievable. I had Dr. Powell Sr. come in and take a look at Cliff. He had gone through decompression and multiple chiropractic treatments, and we had mentioned earlier, something doesn't seem right. Well, we had done all of what we thought was right based on what we found, but he wasn't responding. And so I called him in, and a couple of specific neurological tests led Dr. Powell to believe we should send him to Cleveland Clinic. Mm-hmm. Ended up doing an MRI of his thoracic spine, which we tried to order before, but they said it was medically unnecessary, by the way. And so when they finally did it, they found a tumor on his spine. And and Cliff, of course, commented on this, we had very little time to find this, and we got it just in enough time that they were able to remove it, and he was going to come out of that so that he wasn't paralyzed or otherwise permanently disabled.
Amazing.
Yeah. So God has been good to us.
His hand is here. We know
Yes,
that. And
he
we
is.
thank him
Yeah.
for it, because that's where it all comes from. We say it this way,
Yeah.
the power that made the body heals the body.
Heals the body, that's right.
It's not us.
No.
It's not medicine. It's not antibiotics, it's not Band-Aids. When you cut your arm open, the Band-Aid puts the skin closer together but doesn't do the healing. The antibiotic cream very well may keep away bacteria, but it doesn't do the healing. The healing comes from within.
Right, that's right. What's great is Cliff and his wife are still coming today. So,
Awesome.
Yep, that's awesome.
And you had mentioned it earlier, there are patients that knew me as a kid running around my dad's clinic that still call me Jimmy because that was my name as a kid.
Yeah.
And once they find what works for them, they stick with it.
Yes.
And so many of the folks that we have here are referred by somebody else, a family member or friend, and that's been the lifeblood of this clinic.
Well, and that's the staple of what we call wellness or maintenance care. You can call it what you want. I call them tune-ups, you call them tune-ups.
Yep.
Just like you would take care of your car, you take care of your spine. So once you've achieved your health and you feel better, we highly encourage people to continue to do it, or they can wait till they hurt again, whatever they want to do. But we have a lot of folks, obviously, especially the ones that saw Dr. Powell, and he's been retired a number of years, that are still coming because they know the benefit.
Same thing with somebody that goes through a diet program and loses weight.
Yeah.
If you lose the weight because you ate healthy, if you don't continue to eat healthy, the weight's coming back.
That's right.
And everybody's done the yo-yo.
That's right.
The yo-yo diet.
Yep.
So we encourage lifestyle changes best we can.
Yeah, that's right. And many do.
Many do. So the disc recovery program, we test, we measure, we confirm, then we treat.
Yep.
So.
And then we retest.
Correct.
Repeat all those things that got us to the original diagnosis and treatment plan to see what's changed.
Yep. Everything's pre and post.
Pre and post.
Pre and post.
Yeah.
So we'd like to encourage you to stay with us. Episode 7, we will tell you if we can't help you and do our best to find the person that can.
That's right.
So stick with us.
Yep.
Thank you so much.
Powell Chiropractic Clinic introduces Discovery, the alternative to back surgery. The advanced Discovery protocols created in 2006 by the doctors at Powell Chiropractic Clinic are healthy and effective ways to avoid surgery and relieve pain. Innovators in chiropractic care, Dr. Jim Powell and Dr. Walter Null invite you to live pain-free, drug-free. Call today for a free no-cost consultation and preliminary examination. Powell Chiropractic Clinic, located on Munson Street Northwest in Belden Village and at powellchiropractic.com.